relapsing.
Or it's the rectal pressure.
Oh, yeah.
That was my second guess.
That's your second guess. All right. You can just shout them out for any of the letters. And if you need to.
Aches in lower back.
Yeah.
Are you looking now?
No, I have all these memorized.
She was good. She started.
Verbatim.
Yeah.
The aches in your lower back. And this one's pretty easy.
Anyone want to
No.
guess?
Nausea.
I said nauseous first.
All right. S.
Smiles.
Shaking.
Shaking.
You were right, and you weren't
Nice.
even here.
Was that just a good random guess?
Yeah, it was. It was because he wasn't even here.
All right. One of the R's.
Irritable.
Irritable, yes. And this is also irritable. And this is for the guys to remember. She can be very sensitive. And this is where you want to weigh out your words. Awesome. Oh, what's the other I? She may say this.
Impossible.
Impossible, or I can't do it. And the O kind of stands, it doesn't actually start with O, but it's
Oh, hot or cold.
or the
Oh.
hot
You did.
or cold flashes. And the last N.
Which one is it?
Need to push.
Yes. A lot of times she will have the need to push. So those are signs, like labor normally gives us signs that we start. These are signs that we're going into transition. So it's just a little bit of review. So today, it is a little bit of a heavier subject that we are covering. It's going to be the hospital procedures, the pain medication. So what I want you to remember is 96% of laborers do not need any interventions. Only about 4% do. So as we look how amazing God made our bodies, we still have to remember that we do live in a sin-cursed world. So that's why we are looking over it, even though if you are wanting to do a home birth or a birth center birth, you may be like, why do I need to know this stuff? But just to know the stuff in case things don't go as planned and you need to be transferred to a hospital or anything like that. That way you go and you are not like just completely overwhelmed with all the options, but that you kind of know what's happening and you know some of that stuff. So that's kind of why we're looking at that. So as we get started here, like we said, only 96% of them, 96% can be done without any interventions, without any like pain medications or epidurals or anything like that. But 4% do need that, and that's where we respect the doctors that do know how to handle the high-risk pregnancies, emergencies, or complications when they come up. So what are some questions that, let's say something does come up, what are some questions that you can ask? Like if the doctors are pushing for something and you're just like feeling like, what are some questions to kind of get some more information out of the care providers?
What is the risk?
Mm-hmm.
What are the benefits?
Yes, very good. Kind of just asking them questions, and if they give you that information, you can be like, hey, can we have some time to just like talk this over? So whoever, like with your spouse, with your partner, be like, let's just take some time, let's look at the benefits, let's look at the risks, ask them what for information are we going to gain that we did not know before. Just to kind of, instead of just like some people will watch a YouTube clip later, but they kind of feel like they just take over and we go from one thing to the next without them consenting to stuff. So always ask good questions. So let's look at, we're going to start off looking at the pretty common one, the epidural. So can you guys tell me what's the good and what's the bad? What would be a good reason to get an epidural and what would be maybe like a not so good reason? Or what are some of the risks? What are some of the benefits?
Pain. That's a good reason. It kills the pain.
Yes.
You have to watch where you decide to wear back for the rest of her life.
Yes.
That's the con
Yes.
for having
Mm-hmm.
3 epidurals.
Yes.
What Oh, it slows down labor. That's what I learned
Yes.
from
Absolutely.
doing the research.
Oh,
Try-
good for you.
Trying not to get like real opinionated about.
Yes. Awesome. Those are all really.
procedures of them.
Absolutely. So most people think, yay, I'm gonna get a shot and I'm gonna be pain free. Let's look at this a little bit different. And we're gonna do a little demonstration here. And we're gonna look at what goes into an epidural. So I need a female volunteer. So if somebody wants to come up here.
You
and
can
do
go
a
for it. I think you're
volunteer.
ready.
You look too
Volunteer.
I'm already
I'm
like
in.
thought that comes up.
Okay, so let's just say Dorothy decided she's in labor and she's like, I'm going for an epidural. So what's going to have to happen? First of all, she is going to be, you can turn around and face them. She is going to have fluids put in her. So they're going to give her an IV port and hook her up. And this different locations will give you different amounts of fluid because it varies in what they say is each location kind of has their own, like, this is the amount that we want the mom to have before she does. So as soon as my tape cooperates, we'll get her an IV.
The worst part of getting the epidural put in was like curving your back hard enough to
Pushing
have it
over.
put it in
Mm-hmm.
between contractions
Yes.
with a big like pregnant belly, and then like my epidural spot got scar tissue on it, so like it's really sensitive, so like any kind of pressure made
Makes
me go
you
like,
went to like,
you know.
yeah, wow. So you're
for Grayson, it was like he was getting really frustrated with me. He's like, "You have to push out your back," and I'm like, "I can't! Like I'm doing my best here."
I'm like,
So-
your doctor.
Yeah.
Wait, what are we doing?
We're doing your IV port right now. All right. So now you're hooked up to the IV, and Matt, we're gonna have you because you're like kind of hooked up to a pole and
So
all
you're
the
my
stuff
pole.
beside you. So you're gonna be the pole, so you can go.
Sit the
All
whole.
right. All right. So now we're gonna put fluids in her, and the main reason we put fluids in her is to make. A lot of times the blood pressure goes down when mom gets an epidural, so that's to kind of try to counteract the blood pressure going down. Because if mom's blood pressure goes down, baby's heart rate goes down. And sometimes, like you said, the second stage of labor can get longer, so what they do is put Pitocin in with the IV so things keep progressing.
I did not know that it slows down labor until I was doing the research for the thing or for tonight, and I was like,
Yeah, they
What?
told us. Yeah, they told us.
I couldn't remember that.
All right, so
Yeah, I think
Now-
when they give it to you, they say just so you know this could slow down labor.
we're gonna do, and you're probably a pro at this. You could probably do this all by yourself, but you don't know. So then she's gonna have to have a blood pressure cuff to see if her blood pressure is going down or not. So they want to detect that. If it happens, they want to detect that as soon as possible. So now, at first they take it like every 2 minutes, and then after that it'll be about every 5 minutes. But it's a continuous blood pressure cuff. So that's just kind of hooked up to its own little machine. So we'll just leave that guy hanging there because they want to make sure her blood pressure stays good, because if that drops, then baby's heart rate normally drops too. So we got to make sure that's all good. So then they also want to make sure baby's heart rate is good.
So they have to
So which
put a
monitors did you have? The both times you had epidurals?
The belly.
The belts?
Yeah, like double belts.
Because that's kind of the most common is the belts.
What are the other
But they
options?
also have like the internal where they just kind of hook up to the baby's scalp.
Oh, one of
They like
my
the
labors,
internal.
like they started, her heart was kind of dropping, I guess, and then they did that.
Alright, so we're just instead
That
of
was
going
for
around
Gianna.
this, we'll just nicely,
And the belts are very uncomfortable.
yes. And sometimes then they'll also like
Like,
do,
it's just another thing, like you can't, whenever
Yes.
you move something,
then you make your belts
slides
smooth.
out of,
Yes.
like. and
So
then they
that
have
is
to
normally 2. We're just going to
fix
do 1
your
because we get the idea.
thing.
So that's just continually, because they want to make sure baby is not in too much distress, because mom is no longer feeling contractions, but the contractions are happening. Baby is still feeling them, even if mom is not. So they want to make sure baby's heart rate is good. So then, on her finger, Dorothy, can you tell us what goes on your finger? Remember?
I know what it feels like, I know what it looks like, but what does it do?
It is the pulse oximeter.
So it would be my heart.
So it wants to see how much, we'll put it on this hand here. So I got you all hooked up over here. To make sure you've got enough of oxygen content in your blood. Because if mom's blood isn't having enough of oxygen, what does that mean for baby? Baby's may not be getting enough of oxygen, so we gotta make sure mom is. If they feel like that is not high enough, they may give mom some oxygen or ask her to take some nice deep breaths. All right.
You are? The reason they all put it on one hand is so you have one free hand.
So you have at least one free hand. And then, like Dorothy was saying, your epidural catheter, which that, I think she explained to us pretty well because she's done it, is they ask
I
you.
do believe, I never watched him put it in, and my husband did freak out at putting it in. Like, it does not feel, like getting the needle in is the worst part, I think, having to hunch your back. Otherwise, it's not.
Okay.
I wouldn't consider it painful or anything.
So I'll make sure I don't get any hair back here. So here is her epidural catheter, and she told us how we have to you have to kind of hug your belly, hunch over so they can get the exact spot. Normally it doesn't take them too long if you hold pretty still. But they get that in, but then they have the little port and you're hooked up because it's like a continuous strip in the IV. And then,
Disclaimer for the epidural, so with my last one, I must have moved and it started going into my back. And then the epidural stopped working while I was 2 hours, an hour and a half before.
what's happening? Uh-oh.
Epidural.
Twirl. Oh, thank goodness.
So they had to lay me on my side while I was in intense labor.
Oh dear.
And be the lights were really bright, really bright. I think it's going on her back. See that bubble there?
Oh no. That's not what you wanted to
That's
hear.
10 minutes later, the midwife came in and is like, she's ready to push. Get out of here.
Well,
After that, I don't remember. People just
Awesome.
cleared out.
So then normally if your epidural works really good, you can't tell if your bladder's full, you don't have any feeling. So I'm just gonna put it on your
forgot
kneecap.
that part.
Yep. So now she's gonna have her bladder catheter hooked up. And because she's got IV dripping into her, a lot of times your bladder fills up pretty fast, but you don't feel it. So that needs to definitely be emptied out. So now that she's hooked up to all of this, she's got some good pain relief. And what's going to happen now, because she's got all this, she can't feel from
Yeah.
her
you can't
tummy
feel
on
from-
down.
But the epidurals are only meant for belly though. So when the baby, you'll probably get to that, when the baby gets below that, you start feeling again.
Tell us how it feels.
Pressure, it's crazy painful,
Okay.
just like normal labor. So
Mhm.
the only reason the epidural is just to numb while you're in whatever stages of labor until the baby gets down past that, which I don't know what point.
Yeah.
it
So a
is.
lot of times when moms, when labor keeps progressing, they get to that point where they're like, okay, now I feel a lot of pressure. But a lot of times, moms can't really feel their legs, or if they do, it's just kind of really heavy blobs. They
Yeah,
can't
they
really
never let you walk.
function
I
or
would've been
anything,
able
so-
to walk, I think, with most of mine. They didn't. I
Yeah.
couldn't move my legs and stuff.
Okay. So then a lot of times they want you to stay in bed. So now that we got an idea, we'll take all our strings off of Dorothy here. Thank you much. Just tap this.
Me through all this trauma.
So if we do, there we go. Oops,
Thank you.
not the tape. Thank you.
I have to roll your all apart behind you today.
Yeah.
Not when I had a catheter in.
Yeah. So let's look at what are some of the good, or what are some of even the good reasons to get an epidural. Dorothy, like Dorothy said, the good pain relief.
Is there anything besides pain relief?
So there is. So sometimes when moms get completely worn out, like they're just like, they can't go on, they're tired, they're physically, their muscles are like done. Sometimes it's good and even if labor looks like it's not progressing, like they're just so tense and so worn out, then sometimes it's good for them to get an epidural. That way they can get some rest. Sometimes they even can get some sleep. So that way then they can keep going. So that is sometimes one. And like that full stuck labor. So those are some good reasons to get an epidural. Now let's look at some of the not so good reasons, or the risk of the epidurals. Anybody know any of those?
Didn't Olivia have an issue?
Yeah, so his sister went into labor and like everything happened really quickly, like
Okay.
a few hours, I think, from start to finish. Like when she delivered to like when she started.
Okay.
And so she got to the hospital and they were going to give her an epidural and they didn't stick it in the right spot because she was contracting when they did it, and they told her later on that she could have been like paralyzed because of that.
Wow.
And so that's a risk,
Yeah,
I would say.
that is a risk,
Wow.
definitely, and
But-
usually they'll kind of tell you that, make you sign papers and
Yeah,
and you know that, but yeah, that's kind of a scary side
I would
effect.
think that's just something the doctor wouldn't mention afterwards.
Yeah, exactly.
Yeah.
I
That
think
was
so.
really brave.
Yeah,
Yeah.
and it didn't help at all. Like she said that she felt everything, and like it wasn't even worth it.
So it
to,
wasn't even, oh,
Mhm.
that's not good. That's
Yeah.
not good, wow. So one thing, like we saw, like with Dorothy, like you have to be hooked up, so you're gonna have to be pretty stationary. Unable to move around, there's the risk of like your blood pressure going down, and like we said, you're not feeling the contractions, baby's still in there, baby's still feeling that. So that can cause fetal distress. And that sometimes, if mom runs a fever, that means after baby's born, they're gonna be checking baby, make sure baby has no infections or anything, so that's gonna mean baby's gonna have to be apart for like those blood draws and everything from mom. So that's just some of the not so good. And for first time moms, there is the thing of increased use of forceps and vacuum extraction and a higher rate of C-section for first time moms.
so why do they do it then? If there's so many like risks.
It's sometimes moms want that relief.
Oh, okay.
Yeah.
I guess that makes
So that's, yeah.
I think having to have Pitocin used on all three of my kids, like it's a no-brainer.
So
Like, because I can't really remember what a non-Pitocin induced contraction feels like. But they're just really, really intense.
So is it the same as the epidural, the Pitocin?
So
Like,
what
can you have
Pitocin is kind of like a fake hormone to get your body to contract.
Uh-huh.
But a lot of times what happens is, since it's a synthetic one, it's not like the same as your hormones, and so it usually causes contractions to be really, really intense and really, really hard.
Oh, okay.
And so a lot of times, like if moms need that, like things get really intense instead of like just their body doing it on its own. And so then a lot of times then the pain relief, just because, did yours get to be like contractions just one on top of the other? Mm-hmm. Yeah. And so sometimes moms just can't even like regain to like.
I didn't, with two of them, I didn't even, like once they put me on, once I felt them getting stronger, I'm like, give me the epidural.
Yeah.
But I know with Grayson, what I was learning from this was like the contractions can actually cut the oxygen from the baby, like that's it. Because I know with Grayson, at one point there wasn't any breaks, like they weren't patterning, they were just bam, 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 and then you'd have a little break, and then it's just crazy. And so I'm like, that's really a miracle that he came out You know,
Mhm.
what
Yeah.
like his heart rate didn't drop. Everything was fine.
Mhm. That's awesome. Because
So-
usually like when the uterus is contracting, like it kind of like is like squeezing the baby out. And so normally baby's heart rate drops, but then like when, especially towards like the very end, but then it usually bounces right back up. But that's the whole like thing when contractions are like one on top of the other, like baby's heart rate doesn't have a chance to bounce back up. So that's one of the risks. So some things to remember, even if you do get an epidural, you still need support, you still need somebody there with you. Even though you're in bed, you can still change positions. Even if it's like you can get them to kind of do like a semi-reclined, turn to each side. So even within being in bed, still remember to change your position.
I was gonna say with mine, like technically I wasn't allowed out of bed, but I could move myself. I could do, you know, so it wasn't like, I don't know if they can adjust the strength of them because it wasn't like something that you would have for a C-section or something like that, where you could, like I could move my legs, I could feel my legs, they were just tingly, kind of itchy.
Okay. Yeah,
So.
and that is another one of the side effects where you can kind of get itchy or nauseated or stuff like that. So, yeah. And just make sure that somebody's with you even though you're not getting out of bed or anything, but they can help you change positions. And when it comes to pushing, you may need a little bit more help from your care provider to direct your pushing because it can kind of feel like, okay, I need to push, but where? So they can help you, they'll guide you through that. So we're gonna take, if you guys can move around and get a little comfy. I'm gonna show a clip of, this is the, when you, yeah, it's kind of self-explanatory, but when you get an epidural, sometimes the cascade of how things go. So you may need to, I'm just gonna set it here on the coffee table. So I don't know if you guys can all see, you might need to change your positions a little bit. Can you see?
How long will you be in labor? Like, oh, it's been 12 hours, so now you need Pitocin. Well, I did know the pressure was on. You know, as we got into like 20 hours, 21 hours. At the hospital, I had Pitocin, and then that made me itchy, so they give you something else for your itching.
I knew once they gave you that Pitocin, you need the epidural. Nobody know that you had the epidural?
And then things go on really strong, so then you get an epidural.
And if you're uncomfortable with it, I'll give you more.
It was very easy for them to start doing things that we hadn't really wanted them to do, like Pitocin and whatnot, because I already had the IV in my arm.
They don't really give you the option, you know.
And then another epidural, because nothing was happening.
You're on your contraction right now. Automatically, they were like, oh, you need an epidural, we'll get the anesthesiologist. So she's getting her epidural, then we'll put in the Foley bowl for induction.
They gave me another drug called Stadol.
17 hours of Pitocin.
They gave me that, and I remember that made me, I was like, what's going on? What's going on? There's something wrong.
Cervidil was the end. Once Cervidil happened, any chance beyond that was gone. It was gone.
I hated that drug.
You know, it seemed to me that once they started an intervention, they all just kind of, it was a domino effect.
The whole thing is like a big snowball effect.
The hospital, you're not allowed to have very long labors. So if you are not dilating rapidly, which you're likely not to do if you get an epidural early in labor, you will be given Pitocin. With the Pitocin in the IV, it will flow into your veins. Pitocin makes contractions longer and stronger and closer together. So then the pain of labor is much worse. So you go with that for a while because you have the epidural.
I was just laughing
at the pain of the contractions is overwhelming the epidural. You need to up the epidural, and then labor slows down more because of that, so then you need more Pitocin. Now you're not feeling the pain of the extra Pitocin because you've got the epidural, but your baby is getting compressed blood and oxygen supply because Pitocin contractions last so long and are so strong, the blood and oxygen flow to the baby is compromised. So then the baby's likely to go into distress, and then you're sent off for an emergency cesarean from a baby in distress from contractions induced by the Pitocin, which was necessitated by the epidural.
Step by step, one intervention leads to a series of interventions. And the net result is the mother finally ends up with cesarean, and everybody says, thank God we were able to do all those interventions to save your baby. The fact of the matter is, if they didn't start the cascade of interventions, none of that would have been necessary.
shows you how there can be like the cascade of interventions. Once one starts, they all start. So let's look into some of the medication drugs, like the Nubain, the Stadol, all of those. Tell me some of the good, the bad about those. What's that?
I said I don't know about this.
I had Nubain with Gianna. It drugged me. It made me tired. I don't think I was able to sleep. I don't think so. I do know that if you get Nubain too close to having your baby, that you're still tired after. I can't remember. I don't think I had that effect because I would have had it like I was in labor with her for too long, so it would have been completely worn off before she was born. That's the only thing I know about it. I never heard of the other one.
Yeah. So they're all typically about the same, and so what we kind of need to remember, what she just said, is it does make you drowsy. The good is it can be administered quickly through your IV. You can take it like in a pill form or inhale it or an injection. So that's a good thing. It can be given fast. The not so good,
But what does it do though?
pretty much what it does, exactly what you stated, is it makes you drowsy. So it's not actually really taking any pain away from you. It's just making you kind of sleepy and drowsy. So a lot of times what happens is moms will kind of doze off or fall asleep a little bit at the beginning of the contraction, and we've seen how when we're looking at labor, like they kind of peak. And so you're sleeping through the first part of it, you get jolted awake when it's hard and intense. And then, like you said, if it is given too far, like when you're too close to delivering baby, it will make baby droggy. So baby can kind of come out and have a hard time with like its breathing and stuff, and it's kind of sleepy, so it can have a harder time nursing and just kind of like waking up from that. One of the, I would say the bigger things to remember is all of the pain medications are going through the placenta to the baby. So they're hard on baby's liver and kidneys. So when we kind of take a look at epidurals and take a look at the pain medication, one thing to remember is if you get an epidural, most of that pain medication is going to the mom and only to the mom. Versus the other medications, they're making you drowsy. They're not like actually pain relief, and they do go to baby. So baby's gonna have to like process that with its hard on the kidneys and liver. So you kind of have to like keep that in perspective and kind of weigh out the risk and the benefits of that. The drugs do go to the baby. So looking at the epidural, looking at the pain medications, you're probably like, okay, so what if things are feeling intense? What are the alternatives? What can we do differently? So that's kind of where we go, backtracking to all the stuff that we learned before, all the different positions, and looking at these 2 cycles again, where if you're doing that conscious breathing and relaxing, it's going to reduce your pain. So kind of looking at that, finding what's going to help you to relax, because if you don't, you're going to tense up, which is going to cause more pain, which is going to cause more fear, and you just go on that vicious cycle. So it's learning how to get off of this cycle and onto this cycle. A lot of, I was talking to my coach about this, and she's a midwife for 42 years, and she's full of wisdom, and she's amazing. And we were talking about, okay, what is the alternative if you don't want the pain medication, if you don't want the epidural? And she said a lot of moms that want the home birth or like the birth center birth, a lot of times the reason they get transferred is because they've completely wore themselves out. They're so tired out that they can't keep going. They're not progressing. So just kind of looking at that, where like we talked about, you know, what's going to help us to relax, what's going to, and something that I would love for you guys to practice, and it may feel awkward, but I feel like if you get the more comfortable and the more normal it feels, the more you're going to be apt to do that, is to practice breathing. So think about it. So kind of being conscious of it throughout the day. Like if you're driving in traffic, if traffic starts getting crazy, I want you to just take a in through your nose, out through your mouth, a conscious breathing. and start relaxing. Whatever like starts to tense you up during the day, I want you to start doing this conscious breathing and see what happens. When you're in traffic, when you're ready to get road rage, do it. Take a nice deep breath. Feel yourself in the seat, and this is for guys too. Feel yourself in the seat and just like pay attention to what it does to you. Because when you're intense things now and you learn to relax, it's going to kind of be like something that you're going to be able to do in labor when things are getting intense, because labor gets intense. And so the whole thing of relaxing, changing positions. Another thing that a lot of times we kind of look over is, so like I say minimum 2 weeks before your due date, is to let yourself mentally prepare for baby. So in other words, if you're working, make sure you have at least 2 weeks off before your due date minimum. I say if you can get more off, that's amazing. If you're a mom, kind of give yourself some space to mentally prepare yourself. Okay, I'm getting ready for baby. We're going to just like prepare yourself mentally for that. If you don't, statistics have shown, if you don't do that, those are the moms that normally, so if you're not prepared in your mind, your body doesn't let you go into labor, like it doesn't let down the baby. And so that causes moms to go overdue, which then a lot of times causes interventions. So we say, just let yourself, prepare yourself mentally. And I would say, I'd really encourage you guys to just like look into that now and be like, okay, as time, because like from the beginning of class now, you guys are getting closer to your due date. So kind of like look at your space, look at the time, and start planning for this. To start letting yourself have some space and some time to get things physically ready for baby, but also preparing yourself mentally. Relaxing into letdown. So the next thing is the research buffet, where I'm going to get you guys to share. But before that, we're going to take a break. You guys can get water. Dorothy brought snack tonight. So we'll go ahead and do that. What I'm actually going to ask you to do is to get your snack and then go bathroom and everything and then come back. It is a longer lesson tonight, and I want to get you guys out of here on time. So get up, stretch, move around and stuff, and then you guys can munch between sharing.